Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by Doug from the United States, who uses LDN. Thank you for joining us today, Doug.
Thank you, Linda. Thank you for having me.
First of all, could you tell our listeners what it is you take LDN for?
I take LDN for a condition known as hypermobile Ehlers-Danlos syndrome. It's a genetic disorder.
Okay, fine. So can you tell us your story, when you were absolutely healthy and fine, and what happened? How long ago was it when you noticed something?
Well, I don't think I've ever absolutely been healthy and fine. The Ehlers-Danlos is a genetic disorder that I've come to learn that I've had since birth. But there have definitely been ups and downs. In my childhood, I was quite affected by symptoms that I didn't identify. Nobody identified at the time. And then through puberty and adulthood, I guess as a male, the testosterone sort of masks and camouflages a lot of the symptoms. I'm 47 right now. About 10 years ago, I started to notice the symptoms coming back, joint pain, muscle ache, fatigue setting in, all those things. And that sort of corresponds to the natural decline of testosterone as we age. And my opinion is the protective mechanisms that it gives us with the Ehlers-Danlos. Eventually, through a series of consultations with my primary care physician, she had started to suggest some things as possible causes, and one of those was hypermobile Ehlers-Danlos. And I am an extraordinarily flexible person. I always have been, but I never knew that was potentially a symptom. Incredible fatigue, muscle ache. I had been on a series of medications for that. I was on some light duty opioids for a year or so. A whole lot of non-steroidal anti-inflammatories, ibuprofen. I was taking so many ibuprofens a day. She eventually suggested that I move to a longer acting anti-inflammatory known as meloxicam, at least here in the States. I was on that for a number of years. It definitely helped. It took the edge off a lot of things. I was pursuing the diagnosis of Ehlers-Danlos for about a year and a half. We eventually got my daughter diagnosed, and then I was diagnosed 6 months later. Immediately following that, I started to really educate myself on the condition and things I can do to support my health and my well-being. And I eventually got a phone consultation with Dr. Pradeep Chopra, who you've interviewed on here before, and I think he's on your board of resources or listed many places in affiliation with LDN. And it's one of the first things he suggested is that he recommends all his patients try it. And it works for a great majority of them. Some of them not at all. Some of them less than ideally. But he suggests that everybody at least look into it. So I did. I got a hold of my primary care physician. She was familiar with it in the high dose uses, for addiction. Had never heard of any sort of low dose guidelines or use. I happened to bring with me to the appointment with her the three guides that are on the website: the prescriber guide, patient guide. I printed those out, brought them with me. They're, in my opinion, the best source of information out there for a newbie who's not familiar with it. She read through, and I left that appointment with a prescription. I started very shortly after at a low dose, like 1.5 milligrams. And for me, I had benefits immediately. I was surprised. The very next day for me was quite abnormally above average, and I thought it was a fluke because we have better days and not so better days. And the day after that was the same, above average, and it just continued above average days in a string, which is very abnormal. Uh, I went about 2 weeks and I doubled my dose, and the days immediately got better again, and stayed that way. Um, a week following that, I went up to 4.5 milligrams, and then eventually rounded up to 5, and I've been at 5 ever since, and it's been right about a year now, and I feel fantastic. My daily aches and pains are minimized. Pain for me, discomfort for me used to be something I considered in kind of like every decision that I would make. How I feel right now, do I want to go do that? Is it going to cause me to be more uncomfortable later? Um, it's still in my mind, but it's not a component of my daily decision making anymore. It's fantastic. Something I was not expecting at all was the reduction in fatigue and the incredible boost of energy that I have. Um, if I would go do anything physical, I would be, feel like I kind of got hit by a truck or something. It just laid out for maybe a day or two. Now, that recovery period is almost nothing. I can do something, I can be extraordinarily physical, and I will be tired at the end of the day, and perhaps the next day I will still be a little tired, but I will not hurt. It's just it has completely changed how I exist as an adult. It's been phenomenal.
Mhm. When you say you had the symptoms as a child, being genetic, did you know anybody else in your family who had had it prior to you?
As far so I am myself and my daughter are the first in our lineage that we know that is diagnosed or that demonstrates any symptoms.
Hmm.
Both of my parents are notoriously not flexible at all. They have no symptoms of any of this. But my father remembers his mom, my grandmother, at 80 years old, demonstrating some extreme flexibility.
Mm.
Uh, just snapshots in his mind. He has seen me do some things, and then he'll mention, hey Doug, I remembered watching you do that there. That I saw my mom do that when she was 80 years old, and
Wow.
so that's the nearest link that we potentially have.
Mhm.
But somehow he has zero symptoms of anything, um, which is not a traditional inheritance method for Ehlers-Danlos.
Mhm. So you said that your symptoms were masked once you hit puberty. So up until puberty, what was it like for you as a child living with this?
I had a lot of coordination issues, as I guess is common. I would trip and fall, twist my ankle. I thought it was normal to come in from recess, having rolled your ankles multiple times, so limping back into the classroom. I didn't know that it was just me. Little kids are oblivious to things. I had fairly significant growing pains, but that's always passed off in children. You'll get over it. You outgrow it. I never did, but it was minimized later on as I got busier in school and life and everything else. Yeah, I had also migraines as a child, fairly severe migraines. They all went away in like middle school puberty area. Um, I don't recall having any of the gastrointestinal issues that are very common, but I do have some of them now as an adult.
So as a child, nothing was investigated. It was all just put down to growing pains kind of thing.
Yeah, growing pains, you're a kid. We were not in a big city with a lot of medical awareness. I grew up in a small town of 5,000 people with one physician in town. So it was, there wasn't a lot of visibility of anything like that. And this was also, 40 years ago.
Yes. And you were saying that your daughter was diagnosed before you.
Yes.
It just seems strange that you weren't diagnosed first. So was it
right.
her diagnosis that brought the medical attention onto you? How did that go about?
We kind of both came to it at a similar time. She had been having, which I've learned is very common with females, a lot more of the GI issues, and she had severe migraines for a couple of years, also kind of at the onset of puberty, where females typically get worse and boys typically get better. So she had been having these issues and had made the rounds with neurologists and things. I had been having separate issues, talking with my physician, and we both sort of were keyed into or learned the words EDS all at the same time and started to compare things. And the reason she got diagnosed 6 months before I did is because nearer to us is a children's hospital that has an EDS clinic, and we were able to get an appointment with them relatively quickly. I think we waited 3 months to get an appointment. They won't see me as an adult. I ended up having to call around, and I got an appointment at another children's hospital 2 hours drive from us, but they did not have that limitation of seeing adults. So I was diagnosed by genetics at a children's hospital, and so was she. Mm-hmm. But different hospitals.
Yes. So your daughter, was she offered anything different than you were offered in the past once she'd got the diagnosis?
No, she's been offered similar meds. We both see the same primary care physician, so she's been offered all the same meds I have. She hasn't thought it wise to take any of those yet, or tried any of them yet. I have urged her to try the LDN also with this. It's been offered via the physician, and she's not ready to try that yet, but she knows the success I've had with it, and she knows, how she can obtain it.
Yes. Oh, that's good.
When she's ready.
Yeah, exactly. You can't force feed somebody to take anything, and you have to appreciate LDN is still a drug. But there are people out there who want to get worse before they take LDN. But if you can get the mindset around that, if you take LDN, you're not going to get worse, hopefully, and that you will improve. But you can't make people want to take it till they're ready.
Yes, you can only teach people and portray information, present information. You can't. Yeah, I agree.
Exactly.
So among the benefits I've had, again, as I mentioned, the decreasing of fatigue and the incredible boost of energy, I have been much more active. And since a lot of the impact of Ehlers-Danlos is, joint and muscle issues, being a lot more active has allowed me to increase my muscle bulk, muscle density. I get out and walk 6 to 10 miles a day. A couple of years ago, I would have been destroyed just by walking 1 mile. I would be sore the entire next day just walking a mile. Now, nothing. That's nothing to me now. And I feel great afterwards. And it has allowed me to really improve my day-to-day.
You were talking about gut issues. Mm-hmm. What did you actually have wrong with your gut at that time? And have you altered your diet?
I have not altered my diet. I think my gut issues are fairly minimal. I think I have kind of a slow, fast digestion cycle, if that makes sense. Some days it goes quickly, some days it goes slowly. Uh, but it is very minimal compared to a lot of the gut issues that I've read that some of the Ehlers-Danlos patients have.
Mhm.
I
So,
cannot say whether LDN has helped the gut issues at all.
okay.
I have no awareness as to if there was any benefit for me with that.
Mhm. So if you were to have rated your quality of life on a score of 1 to 10 prior to LDN, 10 being best, what would it have been?
I would say maybe a 5.
Hmm. And now?
Now I feel better than I ever have as an adult. So I cannot, to me it's a 10. Is my 10 the same as somebody else's, a normal person's 10? I don't know. My 10 is probably a normal person's 8 or 9, but I have never felt this good.
That's amazing. And how
And
long did it?
LDN is currently the only uh drug that I am taking for any sort of pain or other benefit. I'm not taking the anti-inflammatories. I'm not taking anything else.
Mhm. And when you first started, did you have any introductory side effects?
Yes, I did. And there were the ones I had the dreams, the weird dreams. They were vivid dreams, I guess, as it's called. They were never scary or frightening or, anything like that. I'm a person that typically doesn't dream. Maybe once or twice a year, I'll have a dream that I'll wake up and I'll remember or have awareness of a dream. And then suddenly I was doing that every single night. And I would wake up disoriented. I would just say disoriented. Like I would wake up and say, "What was that? What happened?" And I'd just be momentarily confused. And then I was fine. And that lasted maybe 3 or 4 weeks. And uh, perhaps now I'll have one of those maybe once a month, which is maybe closer to my normal cycle of being aware of dreams. But that is the only side effect that I'm aware that I had.
And how long was it before you noticed something?
Notice the side effect
No, no,
of
improvements.
benefit. It benefit.
Benefit.
It was literally the next day. The very next day I had improvement. I didn't know that it was improvement from the LDN. I just thought I was having a sort of better than average day, and it just continued. And it scaled. The better days scaled directly as I stepped up my dose.
And how long did it take to get to where you are today, do you think?
In terms of benefit,
Yes.
um, probably a month before I scaled up to 5 milligrams, which is the dose I'm on now. And I said, I'm feeling really good right here. I will stay at this dose.
And you've been
I,
stable since, have you?
I've been very stable at that dose. I have considered perhaps going above just to see if there's another end of the curve for me, but I feel so good. I haven't really seriously entertained um, modifying or trying other doses. I'm very, very happy.
Do you take any supplements?
I do. I take like magnesium. I take zinc. I take extra vitamin C. I take vitamin D. These are all things that Ehlers-Danlos patients are known to have absorption issues with. So I take supplements of all those.
Mhm.
I think they have been beneficial for me.
What would you say to other people who probably haven't been diagnosed but can relate to what you're saying? What would be your advice to them?
Advice, if you think you have this sort of condition, is do some research into it. Um, Educate yourself about every aspect that you can find about it. Try to find mechanisms and strategies that help to improve your quality of life, and pursue a diagnosis or at least understanding in the medical community. Diagnosis is not the end all be all. but finding the right things that can help you are important, diagnosed or not. And there's a lot of strategies and basically a recipe book of things to try that help a lot of people.
Well, thank you very much for having shared your experience with us today.
Thank you for having me, Linda. It's been wonderful chatting with you.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.